Everyone, and welcome to the ICFJ Global Health Crisis Reporting Forum. We are doing another in our series of webinars around how we can help journalists better cover this pandemic. Today, we're going to be talking to Miguel Marquez, who is a CNN national correspondent. Welcome, Miguel. Thank you for joining us. And before we start, I just want to make sure everybody understands a little bit about what we're doing here on the Global Health Crisis Reporting Forum. We have more than 3,200 journalists from around the world participating in the forum, just on the English forum alone. We also have health crisis reporting forums in Arabic, French, Portuguese, and Spanish. So all told, we have well over probably about 6,000 or so journalists around the world. We're offering at least 6 webinars per week across those different languages. And we're talking with health experts, with journalism trainers, in the fight against disinformation, and of course with very prominent journalists like today's guest, Miguel Marquez. If you're on Facebook, you can just search for the group ICFJ Global Health Crisis Reporting Forum. If you're not on Facebook, just go to icfj.org and click on the COVID-19 resource page where you can sign up to get our newsletters so you'll know all about upcoming webinars and read about previous ones as well. Please visit ijnet.org for a wealth of resources about covering the pandemic and other journalism topics. And ijnet.org is in 8 languages. Finally, I want to remind you that we welcome your questions in this webinar. If you're watching us on Zoom, all you have to do is post a question in the chat. If you're watching us on Facebook Live, you can post a question there in the chat, and my colleagues will forward that to me so I can ask Miguel. All right, now it's my pleasure to introduce our special guest today, Miguel Marquez. Miguel is a national correspondent for CNN. And if there is anything important happening in this country, you will find Miguel there, I guarantee you. He has covered the 2012 and 2016 US presidential elections, the protests in Baltimore, and the death of Freddie Gray in police custody, a story for which he and CNN won some major awards. Overseas, he's covered everything from the disappearance of Malaysia Airlines Flight 370 to the aftermath of the attack on the US consulate in Benghazi, Libya. Before joining CNN, or I should say rejoining, because I think you worked there earlier in your career as well. Before rejoining CNN, he worked for ABC News, where mostly from overseas, where he covered dozens of important stories, including from war zones in Iraq and Afghanistan. So we're going to talk today mostly about Miguel's really extraordinary reporting from one of the global health crisis, the pandemic hotspots, New York City, one of the places in the world that has seen the most deaths from the virus. And among his many stories are a series of stories in which he was in New York City hospitals, in Brooklyn and in Manhattan, and really reporting from the front lines. A lot of journalists have tried to get access to hospitals and show what's happening inside hospitals and have not been able to do that. So Miguel's stories really were unique in being able to show us what was happening inside and talking to doctors as they're dealing with all these deaths right around them. So we're going to show a couple of clips from Miguel's coverage and talk about how he got access to those very graphic stories, some of the ethical questions that are involved there. But then we're also going to, at the end, we're going to talk about Miguel's most recent stories, which have been from Minneapolis, where he's covering the other major story happening here in the United States, which is the protests around the death of George Floyd, killed by police on the streets of Minneapolis. And so he's been doing a lot of stories there, both from the protests at night, dodging projectiles and things like that, to much more inspirational stories with the family of George Floyd, for example. So Miguel, let's start with, we're gonna go back to the pandemic in New York. Tell us a little bit, we're gonna watch your first clip in a moment, but tell us a little bit about how you all got access to these hospitals. Very hard to
That was colleagues. That was colleagues calling every single hospital, asking them, begging them. And with most things in journalism, there was a little luck involved. Brookdale Hospital is it's a hospital in Brooklyn. It's not a big hospital. It's not a wealthy hospital. I think that they were experiencing an extreme problem. And there were, as I discovered after the fact, there were factions in the hospital that wanted to bring light to that. There were others that didn't. As you know, covering hospitals has always been tough, but with the HIPAA laws, hospitals face all sorts of legal action if there is patient information given away, if someone can be recognized, if someone is upset with coverage. So they basically just take a hands-off approach and don't want cameras anywhere near, especially their emergency rooms. And a enterprise, Lauren Devalier, give it up to her, she, enterprising, one of our desk people, they said, yeah, we might be interested in that. And then it was just a matter of chatting with them, talking with them. And I think because of all that experience that I've had, both at ABC, covering wars, covering this, like and I've been in New York for back and forth between New York and Los Angeles, London, all over the place. I think they just sort of felt like, let's give it a try. And CNN, look, CNN's a reputable, serious news organization. Yeah. You might recognize. And in New York, there was a real sense of the immediacy of it, that the rest of the country wasn't quite getting it. I think there was real fear about what was happening in New York. And so I think it was on a Saturday or Sunday, I think they invited us in, and we were in there for 2, maybe 3 hours, 2.5 hours, maybe. It was very quick. And in the emergency room for only, 10, 15 minutes, maybe. And it was just one of those things where the timing was right. And because of that story, then it opened up the door to other stories. And we can talk about that later.
Yeah, you got to another hospital as well. All right, well, let's look at the first clip from your visit to Brookdale Hospital. We're going to see how good my technological skills are here. One sec. All right, we're going to start at the top of this clip, and then we'll watch for just a couple of minutes, and you can really see what horrible situation you saw in Brookdale Hospital.
Every corridor, every corner, every ward.
Bring the juice. Bring the juice.
Every inch of Brookdale Hospital Medical Center in Brooklyn now inundated with those suffering from COVID-19. What are you looking at on a daily basis? How difficult is this?
Well, this is a war zone. It's a medical war zone. Every day I come in, what I see on a daily basis is pain, despair, suffering, and healthcare disparities.
Through Sunday afternoon, Brookdale said it had at least 100 confirmed cases of COVID-19 with nearly 80 awaiting confirmation. More than 20 people have died so far from the disease. On top of its normal emergency flow, coronavirus is pushing the hospital to the max.
We are scared too. We're fighting for your lives and we're fighting for our own lives. We're trying to keep our head above water and not drown.
Doctors, nurses, even those keeping the floors clean, face a rising tide, uncertain how long it will rise, unsure this coronavirus won't sicken them as they struggle to stay a step ahead. What do you need right now?
We need prayer, we need support, we need gowns, we need gloves, we need masks, we need more vents, we need more medical space, we need psychosocial support as well. It's not easy coming here when you know that what you're getting ready to face.
The deaths here keep coming. While filming, another victim of COVID-19 was moved to the hospital's temporary morgue, a refrigerated semi-trailer parked out back. The hospital's regular morgue filled to capacity.
How much room do you have in your morgue?
Usually we have around 20 plus bodies that we can fit comfortably.
And you've gone over that?
Gone over that, and the state has been gracious enough to bring us apparatus to help keep families and keep the bodies in comfortable areas because we didn't want bodies piled on top of each other.
Brookdale needs more of everything. Today, Edwards said the hospital has 370 beds. They'd like to add more, many more. 2 weeks ago.
Okay, we're going to stop the clip there. We're going to get back to watch a little bit more of it, but I want to talk first about, tell us a little bit about some of the ethical concerns that you all had when you were doing this story. Obviously, you kind of took out the focus, what's the term? You blurred the faces of anybody, right, any patient. But talk a little bit about how you maneuvered that.
So before we even got there, I mean, there were discussions with both the hospital and with our own lawyers internally and standards people internally about what you can. I've shot in hospitals before, and I'm pretty comfortable with it and get it. But this was obviously on a different scale. The other thing is that when we got there, unbeknownst to me, the hospital the photographer had his big camera, his big proper television camera. They didn't want that in the emergency room, so I had to go with that. Was all shot on my cell phone. This rinky-dink, beat-up old cell phone. So all that stuff I shot, and they did walk us through there when we did the interview with the doctor. They walked us through the emergency room to see that. So I think maybe that first shot is him shooting outside the door. But when they opened that door the first time, I've seen a few things, and rarely do you, when they open that door and you see an ER that is just jammed like that, the hallways, it was a holy hell moment. It was really, really shocking. So the trick was to try, the trick was to try to shoot as much as you could, because they then said you have limited time in there, and they didn't really want us talking to patients. They didn't want us identifying patients. They were trying to avoid all that. They just wanted to give us the sense. The New York Times had just been in another hospital a couple of days before maybe, and they had some video shot by somebody in the hospital that had been cleaned up for them. We were going to do this ourselves. They were trusting us to do it ourselves. So it in post when we were editing, the number of lawyers, the number of standards people, the number of CNN eyes on that story before it went to air, it was a lot of eyes. And it was a lot of blurring of anything, not just faces, but feet, bracelets, anything that they were wearing that might be identifiable, any screens, anything that's on their wrists, that, anything that could be blown up and seen. And if you could, all those sort of things we took into account, and so far, thankfully, nobody has come back at us and said, "Oh, I don't think anybody was recognizable." I mean, as a reporter, it was a little frustrating because there are details in that video that you can't see because so much of it is blurred. So, on one end of it, I was kind of like, well, what's the point of doing all this and going in there if we're actually going to see it? But on the other end, there was, balancing it against the needs of privacy.
Well, I think you can see enough there. I mean, it is pretty horrifying what we can see, and what you saw was probably worse.
Yeah.
So a little bit about one thing that I noticed was that in that shot of you interviewing the doctor, your personal protection equipment is a lot better than hers.
Oh, believe me, we made a big thing of that. In talking to them, they saw our protection, and I talked about this in live shots and the like afterwards, is that they were jealous of what we were wearing. They now have it. After that story, they got inundated with gear from people who were helping, but at the time, individuals, doctors, nurses, administrators, they were stopping in at Home Depot or wherever on the way into work and buying up those Tyvek suits. They're not very expensive. They are everywhere. You can use it for painting. They basically just repel anything. They're very hot to wear. They're very thin, but if you're in them for an hour or two, they get very, very hot because they don't breathe at all. So they're not very comfortable either. But the goggles, the gloves, double gloved, it's a lot of, and then the stuff on your feet, it's a lot of stuff to put on. It's a lot of gear, and they didn't have it. So it was for them, they looked at us like we were space aliens because we had better gear than they did. And I really felt for them. And there was, that was all provided by CNN as well. I mean, that was the best that we have.
Of course, CNN only had to provide it for you and one or two people going with you. They've got to provide it for everybody working in that hospital.
Yeah.
And you also talked to, people in labs that were doing tests, and it wasn't just the emergency room. I want to emphasize that. But I also want to look at another clip from that same piece that's a little bit more with the doctor that you talked to, because that one was also really pretty emotional, I would say. Let me get to that. That's this clip. And let's watch this one.
ER doctors are used to stress. Dr. Millette says she has never experienced anything like this.
I don't really sleep that well at night. I worried about my family. I worry about my safety. I worry about my colleagues. I worry about how the shift is going to be the next time I come. I worry about if a family member is going to come and be a patient as well or fall victim to the coronavirus. I worry about a lot of things.
The disease, a marathon that healthcare workers alone cannot win or even finish.
It's not up to just only to the emergency department to pull through and to make sure the curve is flattened. This is a responsibility for everybody in the country to help us pull through.
So stay the F home.
Exactly. I'm very.
Is that literally? I mean, how?
Stay the F home. Exactly. Because it's not just us that has to help flatten the curve and take care of everybody. Help us help you.
She says it will take everyone pulling together. The worst day.
Okay, so that I thought was just really emotional, where she's talking about worries about bringing this home to her family and the just the mental health problems that people living in this situation are facing.
Yeah, I had not considered before going there just how difficult healthcare providers' lives are. Every single person we spoke to, whether it was the guy in the lab or Dr. Millette, they had arrangements for how they live their lives. Either they've rented an apartment, or they're staying in an empty house, or they're living apart from their family, or some people say, oh, I strip down in the driveway and go immediately into the shower. All the clothes goes into the washer. Like, it's a whole process that they have to go through just to see their family, or they live on separate sides. I want to correct one thing. Sonia Mogi, producer, got the one at Brookdale Hospital, and then it was Lauren DeValier who got the other one.
Okay, great. Credit to
too many stories. God, COVID feels like a million years ago right now. But the toll, the psychological toll on healthcare workers is something that we're going to be dealing with for years to come.
Right. What about the toll on you? Did you feel any, you've been to wars, you've seen a lot of stuff, but was this hard for you and your crew who were in it?
There were so many unknowns. It's a little scary, but I think my risk tolerance is much higher than most. There was a lot of discussion about who would go in. The lovely Frank Bavona, the photographer, went in with me. A lot of photographers really didn't want to do it. He's always up for a story. It is, and it is going to change the way we live for a very long time. Not just the disease itself, but the economy and everything else. There was a lot of concern going into it, especially that early on, especially into an ER, especially in New York. For me, I kind of felt like, well, if I get it, I assume it's everywhere anyway. I assume I'm going to get it. So it does feel like Russian roulette, though. You don't know quite how bad a case you're going to get. You don't know if it will just be a cough and a sneeze, or it's going to kill you. That's right. Sort of the problem with it. So, or if you're going to give it to somebody else, and it could really harm them. So that's the other issue.
You have, in addition to being inside hospitals, you've been covering the protests, the reopened state capitol protests in several states, and now, of course, in Minneapolis. Have you gotten tested? Do you know for sure that you don't have it?
I have not. I've considered it. My doctor in New York now says that they offer both the antibody test and the test. The problem is, I'm not exhibiting any symptoms, so I don't think I have it. It's possible that I did have a light case somewhere along the way. I sort of feel like if I either didn't have it or don't have it now, I must be a cockroach, because I will live forever. I'll outlive radiation or whatever it is. Yeah. But the problem with the antibody test is that false positives or negatives are so high that you don't know for sure. And even if they say, oh yes, we definitely know you had it, what does it mean? Does it mean you're inoculated for a month, 6 months, a year? We don't know anything about it. So I was a little obsessed with getting a test early on, and now I've just kind of become like, well, let's let them figure it out a little bit further. And when we know what we're dealing with, then maybe it's more important and more helpful to get a test and know what's what.
Okay, sounds good. Well, Oh, I wanted one more question about that last clip we saw. You mentioned that there were no repercussions that you know of in terms of somebody saying, "Oh, that was my father on that gurney," or something like that. But was there any repercussions for the people you interviewed, because they were quite frank about not having what they needed?
When that doctor, emergency room doctors are usually pretty straightforward, and Dr. Millette, Rabia Millette, she was just lovely. And when I was kind of joking, just saying, "Well, what are you saying here? Are you saying City F home?" And that all went kind of viral. And you don't. That's the other thing in TV. You don't think that you're going to get much emotion out of somebody in a total gown and a mask and everything, but she just drove it home in a way that you can hear it as you're sitting there talking to her. I'm just like, oh my God, oh my God, oh my God. Like, and I think that there were some questions internally in the hospital. I don't know everything, but I think there were a lot of questions asked from very high management after that aired, like, how exactly did this happen? And why? At the end of the day, they were extremely pleased with it, I think, from everything I can tell. But I don't think that if everybody at the hospital knew that CNN was coming in its doors, that they would have been as welcoming.
But you do see the sort of the public service benefit of doing it. I mean, when you see, because so many people who don't believe this is real and are not wearing masks or social distancing, if they see that, it does kind of bring it home. Oh, this is what it can become.
It was real. Just those doors opening and seeing those packed hallways. And what I did not appreciate at Brookdale, because we were in there so briefly that we had a little more time at the next hospital, is just, I mean, people are basically drowning. They can't breathe. Their lungs are filling with fluid. The difference between COVID and other sort of pulmonary diseases is that COVID attacks both lungs at the same time and completely, eviscerates them. It's terrifying to see people struggling to breathe, and the rapidity that they'll be chatting with the nurse or the doctor at one point, and 2 minutes later they're intubating them. Wow. It's that quick, and that we saw a little bit of that at Brookdale. We saw it much more later on at SUNY Downstate.
Well, we're going to see a clip from that story as well next. Maybe tell us a little bit about, did the Brookdale reporting lead to SUNY Downstate saying you could come in?
I think that certainly helped. The president, they saw that. The president of the hospital had worked for the Obama administration. SUNY Downstate's also in Brooklyn. They're both in an area where the people who were being affected were mainly Black, Hispanic, poorer. It was an area that really wanted to shine a light on that, and so I think they saw what we did there, unbeknownst to me. And Lauren DeValle had been chatting with them, and so that we went there. I had a couple of conversations with them. They wanted to sort of show us everything. It's rare in journalism where people just pull back the curtains and show you their lives. They said they were going to. I never quite believe it, and then we got there, and they did. I mean, it was kind of shocking.
Okay, well, let's look at a clip of that. I want to remind everybody to feel free to submit your questions for Miguel. I see that some of them are already coming in. After we chat a little bit more, we're going to take a look at your questions. So let me get that clip up. Wait a minute, that's the same one we just saw. My mistake.
She fears.
All right, I think I need to stop sharing that one and share again. Maybe you can riff a little while I
yeah, so SUNY Downstate is a hospital in sort of the south side of Brooklyn. It very big hospital, state-run hospital. Also a hospital that has a college attached to it. It is, they've historically struggled, but it was one of just a few hospitals named COVID-only hospital in New York. So they were They were ramping up like mad when we got there. They had built these, negative pressure tents outside their ER to bring patients in. They were clearing out their hospital. They had reactivated another hospital a short distance away to add beds there. They were looking for more ventilators at the time. They didn't think they had enough. There was a lot of fear, a lot of concern. It was while everything was ramping up in New York City. The one thing that they said, because all the hospitals were adding sort of these refrigerated trucks along the way. Have I vamped enough? There was one thing there was one thing that they said that really stuck with me, is that they were going to shut down a street. Most hospitals had added one refrigerated truck. They were going to shut down a side street and add 3 refrigerated trucks for the number of bodies that they had, and that was terrifying.
Yeah. Okay, well, let's watch a clip from that story.
As we arrive in the ER, the latest victim of coronavirus at SUNY Downstate is being wrapped up in the emergency room bay where doctors try to save them. We visited SUNY Downstate for about 3 hours midday Friday. In the short time we were there, in the emergency room alone, 6 patients coded. In other words, they suffered heart or respiratory failure. 4 of them died. A devastating part of just one day.
This is what we trained to do. This is what we signed up for, just not in this volume. You may have a code, maybe on a bad shift, you may have 2 codes where you carry that emotion and you wonder if you did everything that you could. I think it's emotionally hard to prepare for this level of sickness and suffering and morbidity and mortality in such a short period of time. I don't think any of us are well prepared for it.
Have you ever seen this ER jammed like this?
Not quite like these days, no.
You're not at max yet, but you're pushing it.
Yes, we're pushing it. So.
Okay, so that one, I think you saw even more in terms of bodies and things like that.
We did, and the hospital was, you never quite know what you're walking into, and the hospital had lined up interview after interview after interview after interview, and we really hadn't seen much. We'd walked by the ER and I saw a little bit, but as I was interviewing people, I kept noticing these codes going off overhead, so I asked about that one point. And I'm sitting there doing my 5th or 6th or 7th interview. And I'm like, what am I going to do with all this material? I'm a reporter for a 24-hour network that rarely has time for to stop for more than 2 minutes for anything. So I'm kind of like, well, we'll just keep going. And they were all great. These doctors, they all had great stories. The one that was really surprising, there was a respiratory therapist that, these are the heroes of this, and few people know what a respiratory therapist does. It's funny because she was the one that the hospital was most worried about having talked to us, because she was most nervous about talking to the press, and she was very dry and very sort of straightforward, but she was so emotional and she was so spot on and she was so serious, and it drove home the seriousness of what health professionals are dealing with in a way that almost nobody else did. And speaking to the hospital after the thing aired, they could not believe how their staff came to life and how we sort of captured their commitment to what was going on there. Which made me very proud, obviously, but I like telling long stories. I like telling sort of documentaries. That's the reason I got into all this. So this was a gift. But we got out of that hospital, and I can't remember who it was. One of my managers said, well, how much do you think you have? And I said, well, we could do an hour. You could probably do 2 hours if you want. They said, really? It's like, then you're kind of like on the spot. And I was like, yeah, we could definitely do an hour, I think. And then it literally, we shot that in about 3 hours, maybe 4 hours on a Friday morning into afternoon. And we aired an hour on Sunday night, which is kind of remarkable. I don't think they'd ever turned out anything so quickly before. Maybe once with one of the political documentaries, but this was really, really fast.
How closely are you involved in that editing process at a big place like?
Well, that was it was what, five or six acts, I guess, as they call them, just commercial breaks and everything. So I wrote 2 of them. I then took scripts from the others and would update them, add things in, because I kind of had a sense. I wrote the treatment for it and sort of figured out what acts we would do when. Jim Murphy, the executive producer, sort of switched things up a bit, and he was amazing. He's able to sort of like just get you to focus like a laser on what needs to be done. So I mean, it's just a matter of organizing the material, figuring out the flow of the story, and then having people write it, and then either bulk it up, trim it down, or change it around, or add stuff here or there, because we were trying to do different things with each act. Obviously, the first act was kind of a tease for the entire thing, and then we wanted to dive more into the specifics of COVID and just what a mystery it is for a hospital like this that is a COVID-only hospital. We want to do something on the COVID-only hospital and what that entails. So there were lots of different things we could focus on, and I had all these interviews now where we could actually tell all these different stories. So it turned out to be, I wasn't sure what the target was when I went in, but we found it as we got out.
Good. So Miguel, most of our audience on the forum are journalists from around the world, Latin America, Africa, Asia, places like that. Many of them working in media that don't have the resources of CNN, of course. What advice do you have for journalists? And I should say also that many of them are working in countries where COVID-19 rates are rising, not falling as they are here. So some of this, what you saw when you were in New York, is headed their way, quite possibly. So what kind of advice do you have for journalists who are covering this?
I mean, it's, try to tell the story of how this is affecting real people. I think the way that it is changing healthcare, government, politics, the economy. It is endless, the number of stories and the way that a pandemic is changing the way we work, the way that we operate. I think being sensitive to I mean, it depends on where you are in the crisis. If you are ramping up like they were in New York at the time, then that is the story, and trying to tell that story as sensitively as possible. Who is being hit? What populations? What neighborhoods? What is the vector? What is spreading it? I mean, in New York, they assumed it was subways for a long time and touching. I assume that would be the case as well, and now they don't think it's touching as much. That it's basically transmission from mouth or nose to your mouth, nose, or eyes. That's really kind of disturbing. And so how do societies react to that, and who's getting it, how they're getting it, and what those death rates are, and who's getting sick. It's bizarre to me, as much as we know and as smart as we are as humans, that something like this comes along, same family as the common cold, and it's a complete mystery to us. They cannot figure it out, and it just seems to surprise these epidemiologists at every turn.
What about advice for journalists who want to try to get a story like the ones that you got from inside hospitals? For one thing, would you do that if you didn't have that level of PPE that you had? And what about talking to people, showing the death and all that? What kind of advice?
I felt pretty comfortable going in. I mean, if I didn't have the suit and everything, I mean, if I would probably have worn goggles, a mask, gloves. I would have done the basics and the obvious. I probably would have worn some sort of covering, and then just be able to take it off and toss it out. It's not that hard to protect yourself from it. To me, it's all about being aware of what you're touching, who you're speaking to, and whether or not you're that close. I use the mic on the boom, and I started doing that a few weeks before. And that keeps you away from them as well. The mic itself, because it has the little fuzzy on it, that needs to be gotten rid of. It's just being aware, I think, of what might be infected. But yeah, it is a concerning environment. But I think if you're not touching things, if you have proper protection, you're probably going to be fine. But I also assume that we'd all just get it, and you can take protections, but you're going to get a cold eventually. You're going to get the flu sometimes, I just assumed that this was one of those things you get.
Have you, if you might have gotten it, have you in any way limited your exposure to, say, vulnerable family members or anything like that, so that?
I have told people who are vulnerable, and I've certainly stayed away from people who are vulnerable, that and when I travel, so when you get outside of New York and I'm in Green Bay, Wisconsin, or in small town in Petoskey, Michigan, and they look at us like we are freaks of nature because we are wearing masks. I was somewhere in Iowa doing an interview with a farmer with the boom mic and with a mask, and people were making fun of me on Twitter, and I said, but that's the point. Like, I'm not afraid. They were like, what are you afraid of a farmer for? It's like, well, I'm not afraid of the farmer. I'm from New York. I don't want to give it to him. Like, it's his protection. It's not mine. So it's very funny how that has developed into a thing, a political thing, the wearing of a mask. So yeah, I mean, the last thing I want to do is give it to anybody.
Right. Let's go do some questions. We're getting lots of questions from everyone in our audience. The first one here is from Algeria. Someone is asking about how the civil unrest that we are experiencing now is likely to affect the pandemic.
Yeah, I mean, well, you sort of mentioned it off the top. So I've covered stay-at-home orders in Harrisburg, Pennsylvania, and Madison, Wisconsin, where you had very large crowds. And at that time, it was like, oh my God, what are we doing? We're having a protest in the middle of a pandemic, and all these people. Now, a lot of those people purposely weren't wearing masks and weren't sort of social distancing. Now we're in this extraordinarily angry period of protest where people are mostly wearing masks. Some aren't. But they are certainly not social distancing, and there is a lot of body fluids being spread between protesters and police, and protesters and protesters. And I suspect that we are probably going to see a spike in some of these cities, or at least an increase in some of these cities and states in the weeks ahead. I'm guessing in the next week or so, because it's been we're probably about 8, maybe 10 days off before we start to see the effects of it. But yeah, it's not probably going to be good. What we've just discovered that George Floyd, the man who died, was COVID positive. They don't think it contributed to his death, but it is interesting how it is everywhere. And I think we're going to see a lot more of it. And, I've said for a long time that I just assumed that the autumn would be worse. Now we may have that second wave may come a lot earlier than any of us guessed.
Yeah. All right, let's see. We've got, this is an interesting question here. Goes a little beyond the pandemic, but given your international experiences covering conflict, et cetera, do you think there's a double standard in what kind of trauma you show on the screen from overseas compared to what you are allowed to film and show in the US?
Really good question, because one of the stories, I can't remember which one now, we used some video from Italy, of a hospital in Italy, and all of our stuff was blurred, and then there was this section that wasn't blurred, and the lawyer was like, why is that stuff not blurred? It's like, well, that's Italy, it's already aired. And she said, well, we should probably just blur it as well. So then we went through and had to blur all the stuff that had already aired to make it match what we had already blurred in the other stories. So yeah, I mean, it's different laws, it's different rules. We are very protective of hospitals here because they're protective because of HIPAA rules. If they invite us in and allow us in, then we have to live up to their standards. That was trust on Brookdale and then on SUNY Downstate. They weren't sure what we were going to do with it. I think they were pleasantly surprised at how it turned out, but they weren't sure how it was going to turn out. So yeah, I think that there is a very big difference in the way that we treat international material versus domestic. That said, if you look at the George Floyd stuff and how just horrendous that video was, I think we've shown it a lot, and I know people don't like the violence porn and that, but to show it in a way, I mean, we don't use it in bumps, we don't use it in teases, we don't just use it as wallpaper to talk over pictures, but to talk specifically about what is happening in that 8 minutes and 46 seconds that cop's kneed his neck. It bears repeating, and it bears watching, even though it's uncomfortable.
Yeah. Okay. What about what we kind of addressed this a little bit, but what do you project to be future angles to the COVID-19 story that reporters should be on the lookout to cover, or underreported angles, whether in the U.S. or elsewhere around the world?
Well, the one that I want to get at, and I probably shouldn't be saying this publicly, but that people are already reporting on it, but how it's going to change our economy here and the economies around the world. Warner Media has just moved into its fancy schmancy new headquarters in New York, and they've calculated that if we wanted to move all those employees back in now, they need about, I think, 2 or 3 times the space to get proper social distance. So I think companies across the board are going to be facing this. How do you you squeeze your employees back into offices where there's not space? And so until there's a vaccine, until there's a cure, until you or I feel confident that we're not going to give it to our grandparents or friends or children, I don't think anything's going to be normal. So I think that effect on the economy and how companies arrange themselves, working from home. They've always talked about telecommuting and all this. Now it's kind of baked in. This is a sea change. Also in 2008, recessions are as much a downturn in the economy as they are a transition in an economy. 2008, we saw that transition to companies going fully digital. Since then, we've seen towns, whether it's Pittsburgh or Erie, Pennsylvania, which I spent a lot of time in, Grand Rapids, Michigan. There's these Chattanooga, all these sort of secondary cities that have really built up their digital infrastructure that any company could move half, a quarter, a third, all of their workforce to live a better life, be in a cheaper city, and sort of exist. So I think we're going to see maybe sort of a movement from cities to other places. I was in Dubuque, Iowa the other day, and like the digital infrastructure, the amount of office space, these beautiful old mill cities and industrial cities that have been sort of fixed up and refurbed. I mean, they're beautiful cities waiting for giant companies to come in and start their operations there and have people live at a better. Not that I'm on the Dubuque Chamber of Commerce, but like I was really impressed, and I really started thinking then. I was like, wow, these are places that people can go now. That wasn't an option in 2008 because the digital infrastructure wasn't there. Right now it is, because all these cities have caught on and they have really great digital infrastructure now. So I think we're going to see a lot more of that.
Yeah, and what happens to New York and San Francisco and cities that are going to see an exit?
You're kind of seeing it already in New York, especially, but we'll see how many people come back after all this is done. But yeah, it's interesting.
Yeah. Now, another story that's obviously going to be hugely important here related to the pandemic and in many other countries as well is elections. You've covered the last 2 presidential elections. Do you see what are you expecting? How is our coverage as journalists of the elections going to be different this time? What kind of story should we be looking for?
Oh well. So yeah, I covered a lot of election news before this. I think the president is clearly driving sort of how we will cover this. The law and order aspect to how he has projected himself feels to me very, very old. It feels 1968 Nixon, all that sort of stuff. It feels to me like a playbook. I think we'll be looking a lot at the suburbs. I think he thinks that he can win the suburbs back that way. I think that there is that fight for sort of middle America. The thing that's interesting with this, I've covered Freddie Gray. I've covered a lot of protests around the world. I've covered a lot of the protests here in the U.S. and a lot of these controversial police killings. We've had the Ahmaud Arbery thing. We've had Mr. Cooper, the bird watcher in New York, and now George Floyd, all within this sort of compacted period of time. And I think sort of white America, just America in general, sort of got this before. But seeing that video of George Floyd, on the ground with that police officer with his hand in his pocket, sort of staring off, just like he's waiting for his order at the local food store, just as cool and calm and casual as that. while someone's dying under his knee. There was something that just, I think, clicked, and something feels different this time around. So I think that line is going to be what we're seeing now is going to carry through the election, between the reaction to COVID, three crises all at once, sandwiched together. And I think that will probably carry us through the election cycle. And for us, I don't know that it's going to be that different. I've been, in Pennsylvania, Wisconsin, and Michigan. I should take up residency in all three at this point because I've been there so much. And I think it'll just be a lot more in those places, and looking at the suburbs, the suburbs around Philadelphia, the suburbs around Milwaukee, all those places are huge number of votes, centrist sort of Americans, and where they go, the country will go.
But one difference will be the candidates may not be there. I mean, Trump has certainly done some traveling now. Biden, very little. You're not going to be covering rallies probably to the extent that you used to.
Thankfully, I didn't do that to begin with. I was more. I'm a man of the people. I get out and talk to people who are actually experiencing stuff and doing stuff. So I really like talking to, and we tend to sort of disregard anecdotal data because it's not statistical. It's not it's not our poll. But in 2016, if I were a little more ballsy and smarter, I would have really pushed what I was seeing out there anecdotally, because it was very clear there was not a lot of love for Hillary Clinton, and there was a lot of hatred of Hillary Clinton, and people were very, very divided on the issue. In hindsight, of course, it's much clearer what was going on out there. I could have been a lot more aggressive on that particular story.
A couple other good questions from here. One person is talking about underreported stories. This is Nirasha Piwadani from Sri Lanka. Sorry, I haven't been able to name everybody. Sometimes I can see the names and sometimes I can't. But Nirasha talks about one of undercovered story is sort of the racial disparities in who's falling victim to COVID-19. Tends to affect African Americans much more than white Americans. Other countries, of course, may see more of a class difference in terms of who's suffering the most. Do you think that's a story we should be reporting more?
Well, I think we have reported quite a bit on it, and I've certainly pushed a lot of, with all the hospitals and everybody I've now met, we have tons of analysts and people who come on and talk about that particular issue on CNN. It's something that we certainly built into the documentaries and all the discussion around those different stories that we did at both Brookdale and SUNY Downstate. So I know the New York Times has done a lot on it. The Washington Post, the mainstream media at least has done a lot on who is actually being hit by the virus. And that's why I'd be interested overseas. Are they seeing a similar sort of dynamic, or is it more a class-based dynamic, or is it racial? Is it who is actually being affected most by this latest thing with children getting these sort of odd side effects from the disease is really interesting as well. So it's not as widespread as others, but it certainly seems odd.
Yeah, we did a webinar from South Africa that focused a lot on that.
Right.
Poorer parts of South Africa obviously are where people are very crowded together, very hard to socially distance. So let's see, we've got, I'll ask one more question, then I do want to show one quick clip from Minneapolis and talk a little bit about that. This one is, what advice would you give to this is Megan Horsted, don't know where she's from, but what advice would you give to smaller news media outlets looking to engage in talks with leadership at local hospitals to shine a light inside emergency rooms? As you talked about, this was your colleagues doing that work, but how do you convince them?
Yeah, I think it's tough. I think it was a confluence of factors. It was the fact that it was CNN, a responsible, respectable news agency that they knew. It has a very big presence in New York City. The producers made contact first. I think the fact that I had pretty broad experience and they didn't see me as sort of a bomb-throwing flamethrower, that I'm interested in this story. This is I get too interested in the story is my problem, and too sort of emotionally connected to it. And I think it's really hard to get hospitals to trust, especially an unknown like this. I think it was very difficult for them to trust CNN, to be honest. I truly do not think Brookdale probably would have done the story had, how do I say this, had everybody at the hospital known what was going on. I think that it was on a weekend. I think there were different factors or factions in the hospital that were sort of discussing this, and we just in, out, then it was done. And once that opened the door to SUNY Downstate, without Brookdale, we wouldn't have gotten SUNY Downstate. Yeah, I mean, a lot of this is luck, but it's very, very difficult to do that. I think maybe you can do it in small slices, build, do it on one doctor, a very specific story, and then build from that into other stories.
One suggestion I have is you might show the clips that we showed and show how, that led to raising awareness in the community about how serious this is and what healthcare workers are going through.
I will say we've tried to get into other hospitals in other cities, and it's been no way, not a chance, buddy. Yeah. But we'll see.
Yeah. And I understand why hospitals are doing that, but people don't take it seriously if they don't know people who are affected, if they don't see people who
totally. It was a public service that both those hospitals did, and I really appreciate that they did.
Yeah. Okay. Well, let's go a little to Minneapolis, and while I get that clip ready, maybe you can tell me a little bit about when you went to Minneapolis, at what point you did it, some of the stories there.
I'm going to have a lot of war stories out of this one for later drinking days. So we were we started in Detroit. We were doing stories on COVID, the economy, everything happening there, and the knock-on effects from the COVID crisis. So we started in Detroit. We were doing stories on the auto industry, did a great one there. Then we went up north and we were doing stories on one of the hardest hit counties, up in Sheboygan County in Michigan, with the highest rate of unemployment. And then this was all part of my grand plan because I wanted to drive across the Upper Peninsula. So we drove across the Upper Peninsula into Wisconsin. We did a story on how it's affecting counties that flipped from Obama in 2012 to Trump in 2016, and how unemployment there is doing. So we were doing that. Then we were in Green Bay. We did, I think, maybe one more story. We were getting ready to get on a plane, and they said, "Oh, can you?" We saw what had happened, and we knew that it was possible. So we actually hadn't booked our flight back because I thought, I think we're going to go to Minneapolis. We had told them the night before that we'd be willing to go if need be, and of course, things were clearly heating up here, and they said, "Yeah, if you don't mind, don't get on the plane, drive to Minneapolis, and we'll see where it goes." And that was a week ago. Week and a half ago, something.
Let's look at a clip from covering the protests that on the streets of Minneapolis, and then we're going to talk about some of the other stories. It's not all violence in the coverage there. Let's see. We don't have volume here. There we go. All right, let's try that again.
We're in the thick of it. Let's go this way.
Yeah, you got to move away from that direct line, Miguel. Make sure the team is safe. Don't worry about it. We see what's happening. You all right?
Yeah. That's a healthy dose.
Yep.
We're fine. We've moved back. Most of the protesters are moving out now. Police are moving in. It looks like it's mostly state patrol. There were several volleys between them with the fireworks from the protesters and the tear gas and the flashbangs from the police. They fired a hell of a volley of tear gas into the crowd to get them out. They had just had enough. The strip mall next to them, the bank next to the precinct, they were being set on fire and being looted. The fire then was being directed at the precinct itself. There was a Molotov cocktail thrown at the precinct. There were fireworks going off. There was a small fire that had started at the base of the 5th precinct, and that's when they had enough. The state patrol started moving up Nicollet right along the precinct there, and they made the announcement 3 or 4 times that they were breaking curfew, and that's when they moved in. Maybe 50, 60 protesters confronted them, and when that volley of pepper spray or of mace or tear gas came, they scattered.
Okay, well, that was an exciting moment. Tell us a little bit about, what you were feeling at that moment. It looked like the adrenaline was really pumping.
Yeah, I mean, it is hard to keep your wits about you in a protest like that. And the worry is you're not quite sure what's coming. You're not sure where the police are, because we're on the protester side. Protesters love to mess with the media while you're out there as well. So you're dealing with that. You're dealing with people trying to grab the mic. You're dealing with all sorts of things coming at you. So trying to be aware. We do have security with us. And the one thing I ask security is, don't be right on top of me, but watch our backs. Just make sure nothing's coming at us. A car is coming down the street that wants to, run through the crowd, or some protester who just wants to grab the mic, or somebody with a bottle, or once the police start to move in, they move in very fast, and in a line, they fire off volleys of tear gas and pepper bullets, the pepper balls and that sort of stuff. So, I mean, you just don't want to get smacked with one of those in the face or somewhere. So it's, there's a lot of things happening all at one time, and trying to make sense of it and get a sense of how it's been building and why police are moving in that way. It looks easy. It's not.
Does not look easy to me. Your colleague, Omar Jimenez, of course, was arrested with his crew briefly.
I can't get arrested in this town.
Every journalist wants to at least go to jail once, right? Have you seen, we're going to actually do a webinar on this tomorrow, attacks on journalists, and we'll have some journalists who were injured in attacks by police, basically, but has happened with protesters as well. Have you seen or been the recipient of any of that sort of violence against either by police or by protesters?
In Baltimore, the police were very aggressive and increasingly aggressive with media. There was an initial curfew order that went out here that did not include the media, and then we lobbied and they turned it around. I mean, Minnesota is very pro First Amendment. They want the media out there. But there were some pretty scary nights. For a couple of nights there, where the National Guard, the State Patrol, which kind of their state police, and the local police, all sort of different divisions operating in the streets here. You weren't quite sure who knew what, and at midnight, you're just a car with headlights. They don't know that you're media. I was kind of like, I wish we had like a press sign up on top or something that we could at least indicate. So I would go up and put my hands out with my press pass and yell at them, CNN press, we're just going through. And most of the time they let us through. Some of them didn't want us going through because they said they had a crime scene or something. So we respected that. But yeah, it was really stressful. Omar, who, by the way, is the sweetest, nicest guy on planet Earth, having him arrested, one, he's African American. That sent a message that it still just confuses me as to why they did it. And then for the State Patrol, and he's on camera, on live television, showing him his press ID. He's with a crew that is clearly CNN as well. All the gear is marked CNN. There's no way they could mistake them for anything other than a CNN crew. And for the State Patrol after that to send out a tweet saying, "Oh, we just wanted to verify who they were." I mean, things really took off after that. I don't get it about working in the government, these governments that do this sort of stuff. But if they couldn't have figured out a better way to undermine credibility in that moment. It was breathtaking, just stunning, and they didn't do themselves any favors. I get we have to operate in their world and we have to sort of pay attention to their rules, but I was really surprised at the way that they did that. Now they've gone 180 degrees. The governor has apologized in person to Omar. He did it in a press conference as well. It's they've gone a long way, but boy, that was dumb. Just dumb.
Yeah. Any advice? This will be the last question. Unfortunately, we're going to have to wrap up. We could go on for a lot longer, but any advice for journalists who are covering protests here or elsewhere in the world?
Be careful. No, don't, there's a desire to be right up on the front lines and right up. And the problem is once that initial surge of energy starts, if you're too close, you're going to get rolled up in it, and you're either going to get arrested or injured, or you're not going to be able to see what's happening. Be in a position where you think you can be a bit safe off to the side, somewhere where you can see stuff happening, but be nimble enough that you can move and actually see what's happening in that moment. And then for me, it's always about the dynamic. What is driving these protests? What is driving people to be this angry? And getting at that dynamic on sort of the bigger picture, when you're not just throwing, bottles at the police or whatever, getting at that dynamic is really difficult to do, and trying to understand that. And, to me, even though you've seen a lot of violence and madness in the streets here, it is those peaceful protests. It is, those people that I have spoken to on those long 10-mile marches that we've done here, and they are young, they are incredibly idealistic, and they want to see a better world. And something feels different about this one, and let's hope they're right.
Mm-hmm. Yeah, that's great. You have done quite a few stories aside from that rather eye-catching one on the streets of Minneapolis at night. But you've interviewed family members of George Floyd, and you talked to a lot of the protesters and covered the peaceful parts too. So definitely want to make sure that people understand it's more than just the stuff that grabs your attention.
Try to tell the whole story.
Yeah. What's next for you? You're going to be in Minneapolis a while longer?
Well, what time is it? It is 10:01. So in an hour, I think I have a live shot. Very close to here. The memorial is happening now. I was just looking at alerts, and apparently police officers kneeled as George Floyd's hearse went along. So I'm looking forward to seeing those pictures and seeing what the reaction is. When I covered the Baltimore story and the Freddie Gray death, it was on the day of his funeral that the worst violence occurred in Baltimore. I think it's spent here. It's hard to tell, but we'll see how the day goes. I'm planning for a memorial, but it may end up being more. And beyond this story, I think a little R&R for a bit, and then probably back to the. I'm guessing we're going to be back to a corona spike in certain places. That may be next, and then the economics of the coronavirus and how the country is reacting and reeling from it.
Well, you certainly deserve some R&R, and I hope you get it. Thank you so much for doing this webinar.
Thank you.
This has been tremendously useful. Your reporting was really, really eye-opening and amazing, and I know I'll be following you for a long time to come, watching what you do around the country and around the world. Travel abroad.
Thank you.
So a reminder to all of those watching, we have recorded this webinar, and it will be available soon on the YouTube channels of both ICFJ.org and IJNet.org. We will also post by tomorrow a write-up of some of the key points from the webinar. You can find that on the websites as well, ICFJ.org and IJNet.org, along with write-ups of all the webinars that we have done since the beginning of the Global Health Crisis Reporting Forum. Those of you who registered for the webinar on Facebook will receive a survey. We really ask you to fill that out because it's extremely helpful for us in planning future webinars. We have one more webinar tomorrow, as I mentioned, on what we've just been talking about, the widespread protests against the killing of George Floyd and how that has led to attacks on journalists, such as Miguel's colleague, as I mentioned, Omar Jimenez. Our guest will be Linda Tirado, a photojournalist who was blinded in one eye by a rubber bullet while she was covering protests in Minneapolis. Brandon Hunter, a Detroit Free Press journalist who was targeted by police as the only African-American in a group of journalists covering the protests in Detroit. Maria Salazar Ferro, who is the emergencies director of the Committee to Protect Journalists, and Ahmer Khan, a prize-winning photojournalist from India who's covered protests in Kashmir and will give us a bit of an international perspective. So that will be tomorrow at 10 a.m. Eastern Daylight Time. You can register on the Facebook forum or just look for a recent tweet from ICFJ with information on how to register. We'll have more webinars next week, and you can find out about those on the forum or on ICFJ.org. I also want to remind everyone one last thing, that ICFJ and Columbia University's Tao Center for Digital Journalism have launched a global survey to map the impacts of COVID-19 on journalism worldwide and to help reimagine its future. To take the survey, just visit icfj.org and you'll see it as one of our featured stories. So thank you again. Thank you, Miguel. Good luck covering the rest of your stories in Minneapolis.
Thank you.
Safe, everyone.